All right. Well, good afternoon, everyone, and welcome to our On the Pulse series. I'm Chris Fortman, the CEO of the Minneapolis Heart Institute Foundation, and I'm just thrilled that you all chose to spend the afternoon with us. So thank you. We have just about over 200 folks joining us, so I'm looking forward to some good Q&A at the end. And it's a very special day here for the Minneapolis Heart Institute Foundation. It is Clinical Trials Day. So we celebrate this profession and we celebrate all of the patients that choose to participate in research. So you can go and share that with your friends and family today. Before we get into our keynote speaker, I just want to provide a little background on MHIF in case we have some new folks with us. So we are an independent nonprofit research and education organization. We are going to be celebrating our 40th anniversary next year, but I'm starting early. And our mission is to improve the cardiovascular health of individuals through innovative research and education. And we're able to do this with our unique partnership with the Minneapolis Heart Institute and Allina Health, specifically with the Abbott Northwestern Hospital and United Hospital in St. Paul. So we have over 100 cardiologists across 40 sites doing this important care and important research. So if we go to the next slide, you can see some of the work that's happening. We have over 200 active studies touching the life of over 2,000 patients. And we do research across the spectrum, what you're going to hear about today in prevention to interventional cardiology to heart failure. And our physicians are highly engaged in both physician-initiated research and industry-sponsored clinical trials. Something we're extremely committed to is the next generation of healthcare providers. And next week, we will be welcoming 12 research interns who partner with our physicians and our research staff to do real research. And many end up in publications and at professional conferences, an amazing accomplishment for those students. And annually at MHIF, we publish over 200 peer-reviewed manuscripts. So the research doesn't stay here, it goes to improve care across the globe. Next slide. Oh, so just, you can see this on our website, but we're really excited to look at what all happened in 2020, despite being a pandemic year. Great research happened here, not only around the pandemic and its effect on cardiovascular health, but research across all areas. And this happens in multiple ways. One way I want to point out is that we are so fortunate to have 9 international scholars with us, ranging from countries like China, Greece, Hungary, Japan, and Brazil. These are MDs trained in their home country, come here to work with us and bring their learnings back. Such an important program. We keep going. You can see again about the patients that we work with, specific COVID STEMI research, our grand rounds, and of course, none of this would be possible without donor support. So a lot of what we do here is funded by philanthropic support, which brings me to my closing slide. Just that this research and education is made possible through folks like you. So thank you so much. Now, what you all came here for is Dr. Mike Miedema, who is researcher and director of the Nolan Family Center for Cardiovascular Health, again, made possible by the philanthropic commitment of the Nolan family. And Mike is also the director of cardiovascular prevention at the Minneapolis Heart Institute. So it's my pleasure to introduce Dr. Miedema.
Hello. Thanks, Chris, and
Hi.
Good afternoon. Welcome, everyone. Welcome on this somewhat rainy afternoon to this talk. I'm glad you all could make it. I'll try and share my slides here. Did that work?
Yes, thank you.
Excellent. All right, yeah. So today we're going to talk about fish oil for cardiovascular prevention. I think this is a really interesting topic for a couple of reasons. One, it's just an incredibly common question. We have a lot of patients in clinic that are on fish oil. We all have a lot of patients that ask about it, and so it's something that we often frequently deal with in clinic. And the second thing that makes it a little bit unique is that fish oil is typically considered a supplement. And most often for supplements, we don't have a lot of research. We often are left kind of guessing as far as what the actual benefits are. That's not the case with fish oil. We have really good studies looking at the cardiovascular benefits of fish oil. So I think it's a topic worth covering. We're going to start with a couple patient cases. So patient number 1 is a 52-year-old male, no clinical history of cardiovascular disease, does have a little bit of high cholesterol, and recently underwent a coronary calcium score, a plaque score, and is found to just have mild plaque in his coronary arteries. His lipids are well controlled on a cholesterol pill, and he asked the question, well, should I take fish oil as well? So we're going to come back to him. Second one is a 68-year-old female, history of 2 myocardial infarctions, so 2 heart attacks in 2012 and 2020, both of which she underwent stenting for. She also has type 2 diabetes and high cholesterol. Cholesterol is reasonably controlled on her rosuvastatin, but her triglycerides are just a little bit elevated. She currently takes a gram of fish oil a day, and she says, should I keep taking that fish oil or should I take more? So we're going to come back to her as well. So if you go back to the beginning of nutritional epidemiology, so the study of how populations are affected by nutrition, one of the first concepts that was raised is that maybe fat intake isn't very healthy. And so this is the 7-country study published by Ansel Keys, who's actually at the University of Minnesota. And he published a study showing that the countries that seem to take in more fat seem to have more heart disease. And so this raised the concept that fat intake is unhealthy. And it was somewhat intuitive. If you look at the plaques that develop in the arteries under a microscope, they're kind of fatty, they're full of cholesterol. So it just kind of made sense that we take in fat and that's what plugs up our arteries. Well, around the same time, there were 2 researchers out in Denmark that said, wait a minute, we've been studying this tribe of Inuit, these natives of Greenland, and they have a very, very high fat diet, yet they don't seem to have any heart disease. And so that raised the question, is there different kinds of fat intake? And maybe not all fat intake is created equal. Maybe certain fats could actually be healthy. And so when we talk about dietary fats, there's saturated fats, which are your mostly animal-based fats, though there are some saturated fats that are plant-based. So your beef and chicken and cheese and butter, the things we typically think of as potentially being unhealthy. Then there's monounsaturated fats. So these are saturated fats that when we say unsaturated, it has to do with their chemistry, how they're chemically made. And so this is avocados and olive oil and nuts and seeds. These are the fats that have been voted to be typically more heart healthy. And then also polyunsaturated fats. So this is your seafood. These are your fish oil, basically your omega-3 fatty acids, as well as a few other nuts and seeds. And so there's different kind of fats, and they potentially have different health benefits. And so when you talk about polyunsaturated fats, we talk a little bit about the chemistry, and because that's how they get named. And so if you go back to Chemistry 101, here are the fatty acids over here. And the acid end is considered the alpha end of the fatty acid, whereas this methyl group here is the omega end. And some fatty acids have their first double bond at the 3rd carbon. And so those are omega-3 fatty acids. And the 2 main omega-3s we think about for fish intake are eicosapentaenoic acid and docosahexaenoic acid. And so we call these EPA and DHA. So when you're talking about fish oil, you're talking about intake of a certain ratio of EPA and DHA. Those are your main omega-3 fatty acids. And so for fish oil, we typically talk about the oily fish having high doses of EPA and DHA. So this is your salmon and your trout, your tuna, a few other ones as well. These tend to be ocean fish that are deep water, cold water fish. Those are the ones that have the highest doses of omega-3 fatty acids. And the American Heart recommends about 2 grams a week of omega-3 fatty acids, about 2,000 milligrams. And so roughly a serving of salmon has about 1,000 milligrams. So a couple servings of fish will get you to 2 grams a week. And we'll come back to why that is in terms of why they recommend that. In terms of the benefits of the omega-3s, there's been lots of basic science on this. And so there are multiple different proposed benefits to taking in omega-3 fatty acids. They seem to have an anti-inflammatory effect, which can help with inflammation. They seem to stabilize plaques in ways that are potentially beneficial. They seem to lower triglycerides and have benefits in terms of improving your lipid panel. They seem to have antiplatelet activity, which potentially can avoid clot formation. And then they seem to stabilize the membranes of our cells, which is good in terms of plaque development. Membranes that are less stable tend to build up more plaque. And so a lot of potential benefits. In terms of where people get their fish oil from, there are numerous over-the-counter options, right? If you go to Costco or any health store, you've got tons of different types of fish oil to choose from. And all these have different ratios of EPA and DHA, can be a little bit overwhelming. And unfortunately, these aren't very well regulated. So we don't necessarily know for sure what's in these bottles and exactly what's in these bottles. And so it can be a little bit complicated. In terms of prescription fish oils, there are several as well. There's Epanova and Lovaza and Omtrig. These are prescription fish oils of EPA and DHA. And all these have been shown to reduce triglycerides. So they're approved by the FDA to reduce triglycerides. Unfortunately, in all these studies, they've also seen a slight increase in LDL and bad cholesterol in people that take these medications. And so the overall cardiovascular benefits are a little bit unclear. And then the last one there is icosapent ethyl. That's called visipa. That's a purified EPA. So that's the EPA omega-3 with no DHA. And we're going to end by talking a little bit about that one. So in terms of the observational data, some of the initial data on fish intake, it looked to be pretty promising. This is data from the Physicians' Health Study looking at fish intake and subsequent risk for coronary heart disease, for heart attacks, and for death from heart disease. And what they found is, in this group of physicians that had followed up to be followed for research, once physicians had about 1 to 2 servings a week of fish, they seemed to lower their risk of coronary heart disease. Now, when they took in more than that, they didn't seem to get much additional benefit. So once you got to that 2 servings a week, you had the benefit. After that, you didn't see much improvement. And so we call this a threshold relationship, meaning once you get some, you do better, but getting more doesn't necessarily make things even better. You just need to get some in order to get the benefit. And then in 2006, there was a big analysis looking at all the studies that have been done on omega-3 fatty acids and fish intake and cardiovascular benefit. And what they found was that same kind of threshold relationship when you added all the studies together. Basically, if you look at your relative risk here, this is your risk of cardiac death. As people took in fish, their risk went down and went down pretty dramatically. This is a 30% reduction in cardiovascular risk. That's a pretty profound benefit. But then as they took in more, the benefit kind of leveled off. So this fit with that 1 to 2 servings per week in terms of kind of the maximal benefit. And so if people that have seen me give talks before, I frequently have this slide in here. And it comes down to the fact that when it comes to a lot of areas of nutrition, we have a lot of anecdotal evidence. We have a lot of stories, right? So-and-so ate this and then they seem to get healthier. Or so-and-so took this one supplement and they lost 10 pounds. Well, that's anecdotal evidence. You can have a grandmother that smokes and lives to be 100. That doesn't mean that smoking is a good idea. And so we really want to stick to the randomized evidence here. And like I said, we're lucky because we have a lot of randomized trials in this area. And so for a randomized trial, it's pretty simple. You take a big group of people, you split them randomly into 2 groups. One group gets the intervention, in this case will be fish oil. The other group gets a placebo, which looks just like the fish oil, but there's nothing in it. And then you follow them over time for events and you see what happens. This is by far the best way to get at the truth. And we have 6 large randomized trials for fish oil, which show us the potential benefits. And so in 2012, this was the Origin trial. And so this was 12,000 people at high cardiovascular risk. So they either had cardiovascular disease or they had diabetes. This was a gram of fish oil a day, pretty straightforward, followed for 6 years, looking at cardiovascular outcomes. And over those 6 years, there really was no benefit. There was no reduction in heart attack or stroke or dying from cardiovascular disease. Shortly after that, we had the risk and prevention study, which was, again, another 12,000 people with risk factors for cardiovascular disease. And a gram of fish oil a day, followed for 5 years, similar outcomes, no significant benefit. Didn't seem to prevent cardiovascular events by taking that gram of fish oil a day. More recently, we had the Ascend trial, which was 15,000 people with diabetes. So again, a large, well-done study, a gram of fish oil versus a placebo, followed for 7.5 years, and same cardiovascular outcomes. And again, no benefit, no reduction in serious adverse or serious cardiovascular events with taking the fish oil. And then even more recently, this is just in 2021 here, this is the OMEMI trial. This was 1,000 elderly individuals who had just had a recent heart attack. Some of the original fish intake data seem to show benefit after a heart attack. And so this was 2 grams of fish oil versus placebo, followed up for 2 years, looking at major cardiovascular events. And they didn't find any benefit. So 4 large, really well done studies, really not showing any benefit with taking fish oil as a supplement. And then the larger trial that was published recently is the VITAL trial. So this is 25,000 people, so a really large study. And this is more of a primary prevention study. So this is simply men above age 50, women above age 55, including a pretty ethnically diverse population, which is great. 1 gram of fish oil a day, followed for 5 years. And again, no significant benefit. Now, because this is such a large study, you can look at different subgroups, and we do see some interesting things there. Fish oil has proposed to be anti-inflammatory, as we talked about, and potentially cancer preventing. In this trial over 5 years, there wasn't any reduction in cancer. However, if you look at the secondary outcomes, one of them was just simply heart attacks. And for total myocardial infarction, there was this slight reduction in heart attacks. So maybe a small benefit in reducing cardiovascular risk in terms of heart attack. And when they do the subgroup analysis, they try and see, are there people that are older or younger that benefited, or men more than women, or people with diabetes versus without? And they really didn't see any differences between the subgroups except for one area. The one group where it seemed to matter was when they divided them by baseline fish intake. So for the people that averaged less than a serving and a half a day or a week of fish, they actually seemed to get benefit. They had a 29 or 19% reduction in cardiovascular outcomes with taking that fish oil supplement. And so again, this really fits with that threshold concept. People that don't have any seafood in their diet seem to get benefit from taking that fish oil supplement. Whereas once you have some seafood in your diet, once you have some omega-3s, getting more doesn't seem to change anything. So it really reinforced that threshold concept. And a lot of times when we talk about supplements, people say, well, maybe they're not taking enough. And so the strength trial is the 6th trial I was talking about. And this is a recent one that looked at high dose fish oil. So this is 4 grams of fish oil a day in 13,000 individuals at high cardiovascular risk. Followed again for almost 5 years. And actually they stopped it because at 3.5 years, they said, this really isn't going anywhere. We're probably not going to see any benefits. There's no difference between the high dose fish oil and the placebo. And so for routine supplementation with fish oil, we really don't see any benefit. And this isn't just one study, right? This is multiple studies that really show on average for the general population, not a significant benefit, even if you're at higher risk for cardiovascular disease. And so we always talk about EPA and DHA. And naturally in nature, we see them always together. There is some reasoning, some basic science to think that the EPA might potentially be beneficial compared to the DHA. And that comes back to that membrane stabilization. It seems as if EPA stabilizes our cellular membrane a little bit more than what DHA does. And DHA potentially makes it a little bit less stable, where it makes it plaque a little bit more likely to develop. And so there might be a difference between the two. And we do have some studies looking at use of just EPA alone. And so this is the JELIS trial from 2007. This was done in Japan. 18,000 individuals, 70% were women with high cholesterol, with and without heart disease. And so the trial was simply a statin plus roughly 2 grams of EPA a day versus a statin alone. And if you look at changes in lipid numbers, we don't see an increase in LDL with this. We had talked about for those other fish oil trials, sometimes there's a bump in bad cholesterol. We don't see that with EPA alone. We do see a slight reduction in triglycerides. So really no major changes to the lipid panel, but yet over the 5 years of the study, for the first time, we see a reduction in cardiovascular events. We see less heart attacks and less cardiac death when people take the EPA compared to the statin and the placebo. And so we see a benefit here with EPA in addition to a statin in terms of reducing cardiovascular risk. And so this trial really spurred on a larger trial looking at aggressive use of EPA to reduce cardiovascular risk. And so this is the REDUCE IT study. This was published in 2019. It's 8,000 individuals with established cardiovascular disease or diabetes plus a couple of risk factors. So a pretty high risk group. They had to have mildly high triglycerides as well and normal LDL levels. Most of these people were on a statin, so most of these people had bad cholesterol that was well controlled. And they were randomized to 2 grams of EPA twice a day, so a pretty high dose, versus a placebo. Again, followed for 5 years, looking at cardiovascular events. And here we see a pretty substantial reduction. This is a 25% reduction in heart attack and death from cardiovascular disease. And so this is similar to what we get with some of the other statin trials, where it's a pretty profound reduction in cardiovascular events by taking a high dose of EPA. So this is very different than what we see with the routine fish oil trials. And so a few other things, we always talk about fish oil having maybe some antiplatelet activity. There was no increase in major bleeding. So this didn't seem to do any harm taking high doses of EPA. And really none of the other fish oil trials have shown significant increases in bleeding either. So it has an antiplatelet effect, but it's likely very, very small. There was a slight increase in atrial fibrillation, which is kind of interesting. We think of it as being electrically healthy for the body in terms of your cells and your cardiac cells, but yet we saw this slight increase in AFib. And actually in that strength trial I showed you, the high dose fish oil study, that one had a slight increase in AFib as well. There's something about higher dose of fish oil which might make AFib a little bit more likely to happen. It was mainly in people who already had AFib to begin with, but it was a slight increase. If you compare it with that strength trial, which is that high dose fish oil study I showed you before, both studies had a 20% reduction in triglycerides. So it suggests the benefit here is maybe not through lowering triglycerides, it might be through something else. And they measured blood levels of EPA in both studies, and both of them had over a 250% increase in EPA. So potentially there's something about the DHA that kind of negates the benefit of EPA. It's really hard to understand why we see this significant benefit with high dose EPA, but don't see that same benefit with high dose fish oil. And so we're still working on why exactly that is. And so what followed that Reduce It trial, the one I just showed you, was what we call a mechanistic study, meaning how potentially does this high dose EPA work? And so this is the Evaporate trial. This was 80 patients who had a CT showing plaque in their arteries. And they were then randomized to a placebo or high dose EPA. And then 18 months later, they repeated that CT scan. Basically looking at what's the progression of plaque like on high dose EPA versus on just traditional standard medical therapy. So most of these people were on a statin in the background. And what they found was interesting. These red boxes here are plaque progression on the placebo, where these blue boxes are plaque progression on the high dose EPA. And down here is a reduction in plaque, and up is an increase in plaque. There's all different types of plaque we can measure, calcified plaque and non-calcified plaque. The one we kind of pay more attention to is this low attenuation plaque. This is basically really soft plaque that turns to be kind of the highest risk plaque. And in the placebo group, they saw a pretty significant progression of that plaque over the period of the study, whereas in the people on the high dose EPA, they actually saw a regression. The plaque seemed to dissolve in the people on the high dose EPA. And so this provides a mechanism for why the high dose EPA seems to work. It seems to stabilize plaque and potentially even reduce plaque in the coronary arteries, which obviously has coronary benefit. And so if we come back to our patient cases, for that 51 or 52-year-old patient, patient number 1, who's pretty healthy overall, I think the answer is probably no. I don't think they need routine fish oil supplementation to improve their health. I would just recommend that they include fish in their diet. We know that eating fish is very healthy for us. Seafood is very healthy for us. Get 1 to 2 servings a week, and then you don't need to take an extra supplement with it. And for patient number 2, who is a higher risk patient, I mean, they've had 2 heart attacks, they've got stents in place, they have diabetes as well. I think the question or the answer for them is that they should stop their fish oil. They should probably start visipa. They should start that high dose EPA to try and reduce their cardiovascular risk. And so in conclusion, I think it's very clear that seafood, especially fish, high in omega-3 fatty acids, is an important part of a heart healthy diet. We should aim to include at least a couple servings a week of fish in our diet if we can. I think that the randomized trials are pretty clear that fish oil supplementation is just not supported by these large studies. It's just better to eat the real thing. And this is something that we see in nutrition time and time again. When we try and get smarter than food, we tend to end up on the wrong side of things. It's just way better to eat the real thing. And so fish oil supplementation for most people is probably not needed. And so, you know, we constantly are worried about giving our patients too many medications. I would include supplements with those. It's an opportunity to reduce the burden of medications for our patients. We want to take as few pills as possible, regardless of where they come from. And so for most people, this is an opportunity to reduce what they take. Now, for people who don't take in any fish, that might be a different discussion. You know, if you have no fish in your diet for access reasons or for preference reasons, then to take a 1 gram a day fish oil supplement seems pretty reasonable. And then finally, you know, for visipa, if you're at very high risk, and so this is not for the routine population, but if you're at high cardiovascular risk, fish oil or visipa is a reasonable thing to try. It's not the same as taking over-the-counter fish oil. Sometimes a lot of people say, well, instead of visipa, I'll just take some fish oil. It doesn't seem to work the same. The studies don't support it that way. It can potentially be a little bit costly. Sometimes there's some coupons that we can make it less costly, but that has to be factored in as well. And so thank you for your time. We have plenty of time for question and answer. I will hang around as long as needed, and I'm happy to answer any questions about fish oil or nutrition or whatever you want to ask.
Well, thank you, Dr. Miedema, very much for your time and expertise. We really do appreciate you joining us today. We do have a couple questions that we did take during the registration process, so we have quite a few ready to go. But folks, if you want to ask a question, please remember to use the Q&A pod, and that's located at the bottom of your Zoom screen. What you're going to do is you're going to take your cursor, drag it to the bottom of your Zoom screen, access your control bar, and please submit it via the Q&A pod. It just keeps things a lot cleaner and easier for us. I'm not sure if we'll get to every single question, but we're going to do our best here. So to start things off, Dr. Miedema, the first question is, does fish oil also help with arthritis?
Yeah, so fish oil definitely seems to have some anti-inflammatory properties. And so there's a reasonable reason to think that it would help with arthritis. There is one small study in rheumatoid arthritis that did show a little bit of benefit. And so it might have, because of those anti-inflammatory properties, a little bit of help with that. Whether it helps osteoarthritis, we don't quite know as well. And in a lot of these larger studies, they keep track of some of those secondary outcomes, and they really didn't see much of a benefit. And so it's an option for that. I think it's, you know, relatively safe to try. I don't know if it's going to have a profound effect.
Yeah, excellent. That makes a ton of sense. I appreciate that. So the next question, and I think there's a few questions in the chat pod about this, and that's the difference between krill oil and fish oil, if you could speak to that.
Yeah, so krill are basically like little tiny shrimp. And so most of them come from the Antarctic, and you can take those little tiny shrimp and make a fish oil supplement out of them. And it has DHA and EPA, just like fish oil does. There's some basic science to suggest that your body absorbs it a little bit differently. And so it might have a little bit of different effect. We really don't have any larger studies knowing exactly what the different effects are. And so I don't think it's an unhealthy option. The people that sell krill oil seem to market it as being a much better option compared to fish oil. I don't think we know that's the case necessarily at all. And if you look at everything that we eat out of the ocean, from mussels to scallops to tuna to halibut to shrimp and to lobster, everything, it all seems to be relatively healthy. I think it's unlikely that krill is markedly healthier than all those things. It's probably not an unreasonable option, but I don't know if it's markedly better.
Yeah, absolutely. So to piggyback off that question, so are there any interesting fish oil studies or krill oil studies or studies in general that you're particularly interested in within this area?
That we're working on at the foundation? Or
just in general?
Yeah, so I mean, for routine fish oil supplementation, we're probably not see any more trials anytime soon, just because we have those 6 large studies. The 2 main areas of interest, we're going to be involved in one looking at intake of seafood in people's younger years and their cardiovascular plaque scores in their later years. And so kind of looking at, we know that the process of plaque buildup is lifelong, and maybe a healthier diet earlier in life can actually potentially affect that in ways that are even more positive than what we think. That's more of an observational study. The main area of research in this is, why is there a difference between high dose fish oil and high dose EPA alone? That's really what probably the next studies are going to look at, because the placebos used in each group, not to get too in depth, but one of the placebo groups was a mineral oil and one was a corn oil. So they're wondering if they maybe behave differently, and the placebo is affecting things in ways that were negative. And so there's a lot of research to be done here yet, but I think that's where things are headed.
Excellent. Well, thank you very much. So this attendee writes, can you talk about the use of fish oil related to how, if it has an effect on the arteries, meaning if it helps with any artery issues?
Yeah. So like we talked about, especially for the high dose EPA, it seems to be anti-atherogenic, meaning it makes plaque less likely to develop. And so by stabilizing those membranes of the cells, it makes the plaque or makes the vessels resistant to plaque buildup, and potentially you can even see plaque progression. And so, yeah, by all accounts, it should be healthy for your arteries.
Excellent. So a follow-up question to that is, what do you have any suggestions if your stomach can't handle fish oil well?
Yeah, that's where I think, this is a risk versus benefit sort of thing. For anybody that's having GI side effects from the fish oil, which definitely does happen, it's probably not worth taking the supplement. I would focus on trying to get seafood in your diet a couple times a week, and you don't need to take the supplement with it. Quality of life is really important. If there was a profound benefit to the fish oil supplement, then we might say, let's try and figure out a way to make that work. But we have pretty good evidence. Again, this wasn't just one study. We have 6 trials, total over 100,000 people. These are as large studies as we normally get in medicine, and there really didn't seem to be much benefit. And so for routine supplementation, most people don't need to take it.
Yeah, absolutely. It sounds like there are a ton of folks involved in those trials. So an attendee writes or asks, after starting a fish oil regimen, how soon could results be noted?
Yeah, so it depends what you're measuring. So in terms of the triglyceride effect, it tends to happen within weeks. And so the lipid effects happen pretty quickly. A lot of those basic science things that we talked about, the lipids changing, the antiplatelets, that all happens relatively quickly. The cardiovascular benefit, we tend to have to follow people for a little bit longer time in order to see those benefits. And that's really a theme we've seen in prevention, where duration of exposure really matters with these risk factors. And the same thing with duration of treatment in terms of benefit. A cholesterol pill or a blood pressure pill taken for a month doesn't do too much. Lowering your blood pressure for 10 years does a lot. And so fish oil for a month would have a pretty short-term benefit. If you want to have the cardiovascular benefits, you probably need to take it longer.
Yeah, that makes a ton of sense. So we've talked a lot about the positive benefits of fish oil. Could you speak a little bit about the negative effects of fish oil? And particularly this attendee asks if fish oil could potentially cause an increase in bleeding time.
Yep. So one of the things we talked about was that antiplatelet activity, where we know fish oil tends to make platelets a little bit less likely to clot. And so going into the studies, there definitely was a concern about bleeding risk. That just hasn't been borne out in the trials. And so these trials can contain, a broad range of people, old and young, and higher risk and low risk. We just don't see any increase in major bleeding. And so that really isn't a huge concern at this point. We do see that slight increase in AFib, especially at high doses. And so that's something to consider. If you have AFib, taking a high dose of fish oil probably isn't a good idea.
Yeah, absolutely. So folks, I just want to remind you to please use the Q&A pod, which is located at the bottom of your Zoom screen. I know we have the chat pod open as well, but we like to use the Q&A pod because it keeps things nice and clean. So Natasha asks if a fish oil supplement supplement benefit, or would a fish oil regimen benefit individuals with familial hypercholesterolemia?
Yeah, that's a good question. So the fish oil doesn't have a big effect on LDL, on bad cholesterol levels. And for people with familial hypercholesterolemia, it's typically driven by really high bad cholesterol levels. And so the fish oil might help with triglycerides a little bit, but that's probably not going to be the main target. And so it's not unreasonable to do. For people with FH that I see in clinic, I would just tell them again, I would try and include the real thing in your diet and avoid the supplement.
Excellent, thank you for that. So this attendee writes in anonymously, and they wanted just to clarify, you recommended a dose of visipa, and they were wondering if it was 2 grams or 4 grams, which is considered high dose.
So the way visipa was studied was at 2 grams twice a day, so 4 grams total, and it's prescription only. And so, yeah, it's a prescription from your doctor, again, mainly just for people who are at real high cardiovascular risk. We wouldn't recommend it for routine use in the general population. But yeah, 2 grams twice a day. There are a few over-the-counter EPA versions you can find. We don't quite know as much about them in terms of how they're made and if they work the same way, but that potentially is an option too.
So a piggyback question to that, and I think it's related, but is there a way to get a high dose of EPA other than visipa?
Yeah, so that's exactly what I was saying. There's a few newer products I've seen on the supplement market that are looking at just purified versions of EPA. Apparently, it's kind of hard to do. It's hard to make it that way. And so, again, not being as well regulated, I don't know if that's a great option, but potentially it is an option.
Excellent. Well, thank you very much. So Nancy writes, is preventive cardiovascular care appropriate for people who have already had cardiac incidents? And what's your philosophy about preventative care for older people?
Yeah, so our prevention clinic that we have, we see a large group of people in primary prevention. So people that have not had an event, they haven't had a heart attack or stroke, and they want to avoid the first one. But we also see a large people in secondary prevention, meaning I've had a heart attack, how do I not have the second one? And so we see a really broad age range. We see people with lots of cardiovascular disease and hardly any cardiovascular disease. And so if you're interested in avoiding a future event, we're happy to see you in prevention clinic.
Excellent, thank you very much. So aside from fish oil, would you recommend taking a general multivitamin?
Yeah, so the Physicians Health study that I showed you, one of those first studies that looked at fish intake, they actually did a multivitamin trial as part of their study. And so for 10 years, they had the physicians, half of them took a multivitamin, half didn't. And at the end of those 10 years, the people who had taken one didn't seem to have less heart disease. They didn't seem to have less cancer. They didn't seem to have less arthritis. It just didn't seem to benefit them in any way, shape, or form that we could tell. And that gets back to the general theme, like I said, of nutrition, where we know that a heart healthy diet is incredibly important. What you eat is probably one of the main predictors of your health. Trying to get smarter than food and take supplements on top of that hasn't borne out the same way. We have negative trials for multivitamins, for fish oil, for vitamin C, and for vitamin E, and for selenium, and for antioxidants. We just haven't been able to find something nutritionally that we can put in a pill and have people take it for benefit. Now, there are some people that have certain types of diets where they know they're probably devoid in certain things. Supplementing that is very reasonable, but just for routine health for the average person, I would just focus on eating heart healthy.
Mm-hmm. Yeah, thank you very much. So John asks if you could talk about the difference in benefits between fish from the ocean and fish from potentially a local lake.
Right, so most of our lake fish, our walleye, and those type of things are whitefish. And so they don't have very high levels of EPA and DHA. So you're not gonna get those same fish oils from those fish. They do have some, just not very much. And so they're great sources of protein. I don't think they're unhealthy by any means, but if you're focusing on getting on some of that omega-3 fatty acids in your diet, you're gonna need the ocean fish.
Mm-hmm. Absolutely. So a piggyback question to that is, what if you're a vegan? Where do you get the EPA and DHA?
Yeah, so you probably won't get EPA and DHA, but there are omega-3 fatty acids and omega-6s that are plant-based. And so ALA is the omega-3 fatty acid that's in several different nuts and seeds. And so you can get pretty good levels of omega-3 fatty acids without eating any fish.
Excellent. Thank you very much. Let's see, try to find another question here. So is there a significant difference in effect of omega-3 versus omega-6?
Yeah, so omega-6 are a little bit less well studied. They seem to be a little bit more neutral in terms of cardiovascular benefit. And so there's studies kind of going both ways, which ends up often being that the truth is in the middle. And so they don't seem to be promoted as being as heart healthy, and I suspect they're probably not. I don't think they're necessarily unhealthy, but those are ones we didn't. More of the research is focused on the omega-3s.
Mm-hmm. Thank you very much. So the next question is, if you could speak to any info that you have on over-the-counter fish oil on heart rhythms specifically.
Yeah, and so originally from some of the observational studies, we thought that fish oil was actually antiarrhythmic, meaning it was going to protect you against different heart rhythms. It was going to stabilize heart rhythms. And so a lot of people were taking it for that reason. based on what we have from these recent trials with a slight increase in AFib, I don't think we feel as comfortable saying that. And so if you have a history of atrial fibrillation, I would avoid high dose fish oil, and I would avoid visipa unless you really, really need it. Other than that, we don't have really any other evidence that it gets rid of any other heart rhythms, like ventricular arrhythmias or PVCs, things like that. And so, yeah, we typically wouldn't recommend it for that.
So Stephen asks if you could discuss the most beneficial fish with the highest omega-3 that you may have already mentioned.
Yeah, so tuna and salmon are pretty high up there. Sardines and herring are as well. People tend not to like those as much. And so it's interesting because farm raised versus wild can be actually pretty different depending on what the diet is. And so EPA and DHA will really differ based on the species and even how the fish was raised. And so the FDA and the USDA have a couple websites that will kind of guide what's in what. And really, as you know, like we started, if you can get to 2 grams a week, that doesn't take that much fish. A good sized serving of salmon can almost get you there sometimes. And so I would go to the USDA website, and again, preference really matters. If it's something that you enjoy eating, I would eat it. I wouldn't try and find out something that's more healthy if you don't like it.
Mm-hmm. Yeah, thank you for that. So this attendee writes that their daughter is a dentist and had a question about fish oil supplements relative to, I believe they meant calcium buildup on their teeth. Do you have any information on that?
From my understanding, there's no link between those things. Plaque buildup in the teeth and plaque buildup in the coronary arteries are very different. We know that there is a little bit of correlation between gingivitis in the gums and coronary disease. That might be kind of both driven by inflammation, but the plaque development in the mouth is very different than the arteries. And fish oil shouldn't affect the stuff in the mouth at all.
Mm-hmm. Thank you for that. So this attendee writes, if you could change one thing in the nutrition of a population of folks over 50 with low to moderate cardiovascular risk, what would you suggest? More fish, more vegetables, and then they write less Cheetos.
That's a really good question. And I only get to choose one. I mean, the 3 things that I would target by far would be decrease in simple carbohydrates. So your white rice and your white pasta and your chips and cookies and crackers. And an increase in healthy fats, so both poly and monounsaturated fats. And so, the only randomized trial we have for a diet intervention that has improved cardiovascular outcomes is with olive oil, with monounsaturated fats. And so those high intake of those healthy mono and polyunsaturated fats is definitely a good idea. Limiting simple carbohydrates is also a good idea.
Mm-hmm. So kind of piggybacking off of the food theme here. So this attendee writes, I currently eat several servings a week of white fish, such as cod. And they said that they didn't see that on your list. Are most of the heart benefits derived from red or dark meat fish? And is there a benefit of eating fish such as cod? Yeah.
So cod is healthy, right? It's got a lot of protein. It's got a little bit of healthy fat. It doesn't really have any carbohydrates. And so I don't think you need to decrease the cod intake from your diet. It doesn't have a ton of EPA and DHA. It's not very high in omega-3 fatty acids. Mm-hmm. And so ideally, if you got at least one serving of a red fish in there, of a fatty fish, that'd be a good idea. But cod is not unhealthy by any means.
Mm-hmm. Yeah, thank you for that. And it does taste very good as well. So this attendee writes, is canned tuna the same benefit? Does canned tuna have the same benefit as fresh tuna?
Yeah, I think so. Especially a lot of canned tuna is in olive oil. And so especially if you have a healthy fat in there with it, I think it potentially is just as healthy, yeah.
Mm-hmm. So sticking with the diet theme, this person is asking about the anti-inflammatory diet and how does fish oil play into that? I know you briefly did touch on that, but if you could expand on that a little bit.
It's a tricky one because, nutritional research is so substitutional. And so if you stop eating one thing, you have to replace it with something else. And so like our low fat dairy movement we had in the US was to take out the fat and put in sugar. Well, that's not a very healthy substitution. And so for these dietary studies, it's really hard to tell what's what. This anti-inflammatory diet, I think, is a mostly healthy diet. It's a plant-based diet for the most part, includes some seafood, which is also anti-inflammatory. We kind of go through these dietary fads. And so we go from keto to paleo to anti-inflammatory. It kind of changes by the year. In general, the themes of the heart healthy diets hasn't changed much over time. It's high in healthy fats, it's low in simple carbohydrates, it's healthy protein sources, and it's saturated fat in moderation at most. And so I think that's going to continue to be the trend. We'll keep kind of reinventing the wheel because it makes us excited to have a new diet. But in the end, those same things kind of keep coming through.
Absolutely. Well, thank you very much. So this question isn't necessarily about fish oil, but they're asking about the cardiac calcium score. And if you could talk about how important that is.
Yeah. Well, for preventive cardiology, we've always wanted some sort of crystal ball, right? If we knew where things were headed, it's way easier to make treatment decisions. If I knew a patient's going to live to be 95 and feel great, that's all right, we're done. We're not going to do anything. If we knew that something bad was going to happen 2 years from now, then we'd do things differently, obviously. And so there's been endeavors into taking your cholesterol and fractionating it down in different cholesterol particles. There's inflammatory panels, there's genetic screenings, there's all sorts of things we can do in the name of prevention. And frankly, most of those tests haven't panned out as well as what we'd hoped. They don't provide a ton of risk information. They don't move the needle enough to say, oh yeah, now you're high risk, or oh, actually now you're low risk. That coronary calcium score, that's probably the best test we have. That's the one test we have that actually does move the needle. If there's no plaque in your arteries, if your calcium score is a 0, it's hard to have a heart attack anytime soon. And so we tend to treat those people less aggressively. You know, it's hard to prevent things that weren't going to happen in the first place. Conversely, the people that have a lot of plaque in their arteries, those are the people that potentially can have events if we don't treat it, and it's very treatable. And so of all the tests to get, that's probably the best one that we have. Now, if you already have established cardiovascular disease, if you've had a heart attack or a stroke or have a stent, then the calcium score doesn't make much sense. We already know you're at a higher risk level. But if you don't have any of those things and you're unsure about your risk, that's probably the best test to get.
So a quick follow-up question I saw in the chat pod is, what happens if your calcium score is over 95? Would that be concerning to you?
Yeah, so there's 2 scores that you get. There's your total score, and then there's your age, gender, percentile, kind of where you rank in your class. And people always jump into that percentile because it makes sense to them. Oh, I'm in 95th in my class. That's really bad. The total score is what matters most. And so 0 is definitely what we want to see. For your average 50, 60-year-old population, about half are going to be in a 0, half are not going to be. 1 in 99, we consider a small amount of plaque. And then above 100, we say that's enough plaque where we should probably start treating things. But we see scores up to 5,000. And so 95 is a mild amount of plaque. And so, yeah, it doesn't necessarily, it's not a test for blockages. That's a key point, is that it's a test for underlying plaque. And so you can have a score of 1,000 and have an angiogram that looks pretty normal because the plaques are in the walls of the vessel. So just because you have a 95 doesn't mean your arteries are all plugged up.
Yeah, it makes a ton of sense. So, so the next question is, are there benefits to taking omega-3 from algae, or if you could talk about that in general?
Yep, so that's kind of the plant-based ALA I was talking about. And it seems to have relatively similar properties to EPA and DHA. We don't know quite as much about it. Again, if it were me, and this is a conversation I have with patients often, I think we want to put as few pills into our body as possible. And whether they're labeled natural or unnatural or traditional or non-traditional, I'm not sure that matters so much. You know, we have a lot of patients that come into clinic, say, you know, I really want to do things naturally. I don't want to take any traditional or any prescription drugs. And, you know, natural is good. I understand that, but arsenic is natural and cocaine is natural. We have a lot of natural things that are unhealthy for us. The goal is to be healthy. And so we know that some traditional medications can make you very healthy. They make you healthier overall. And we have a lot of supplements that are promoted as making you healthy, but we don't have great evidence. And so until there's good evidence, I would probably just focus on eating the heart healthy diet and avoid the extra supplements. Yeah,
absolutely. And I can see that we still have quite a few questions here in the Q&A pod. Dr. Miedema, please stop me if you're running out of time here. But I'm trying to kind of consolidate these into similar areas. But the next one is kind of jumping back and forth here. Do you recommend visipa for primary prevention of cardiac events or just secondary events?
I think at this point, just secondary. You know, it still can be costly. And, you know, the trial was in a high risk population with a known disease, or the primary prevention group in there was people with diabetes and 2 other risk factors. So a pretty high risk group. And so in that setting, we do use it in primary prevention somewhat. That's probably a discussion for you and your cardiologist. And so right now we do use it. We don't use it routinely where everybody should be on it. We really try and reserve it for the high risk people.
Mm-hmm. So if you're currently on a fish oil supplement, are there any considerations or signs that would suggest to stop a fish oil regimen?
No, I think the odds that a fish oil supplement is doing you harm, I think is really unlikely. You know, so there's minimal harm in taking it. It's just that there seems to be kind of minimal benefit as well. And so, like I said, I would want to minimize things in that setting and not take it, but it's always your preference.
Yeah, absolutely. And I know you briefly touched on this, but this attendee asked to clarify the main difference between omega-3 and EPA.
So omega-3 fatty acids are EPA and DHA. Mm-hmm. And so in nature, fish have omega-3s that include EPA, both fatty acids in their bloodstream and in their muscles. EPA is when they purify the EPA and remove the DHA. And so people say, oh, it's still a natural, you know, intervention. We don't find that anywhere in nature. You know, taking 4 grams of EPA is eating pounds and pounds of salmon a day to get that level of EPA. And so it's not a very natural intervention. It seems to be beneficial, but it's not very natural. And so EPA is just one of the 2 omega-3s, and they were able to purify it and remove the DHA.
Sounds good. So I think maybe to round this off, if we do 3 more questions, does that sound okay?
Sure, that's fine.
Sounds great. So this attendee asks, can you speak on patients with high LPA? It appears fish oil lowers LPA. Does visipa also lower LPA?
Yeah, so lipoprotein A is a cholesterol particle that seems to be kind of genetically determined. It's not affected very much by lifestyle. In some families, they have high LPA that seems to drive cardiovascular risk. It remains kind of complicated. We seem to have some families that have really high lipoproteinase that don't ever have any heart disease. And we have other families that have very, very low lipoproteinase that get heart disease. And so it's not a perfect predictor, but it is something we routinely check in our prevention clinic. One of the issues has been is that traditional cholesterol pills like statins don't lower your lipoprotein(a). It tends to stay the same. We do see that with some of the newer ones, and fish oil potentially, there's slight reductions in lipoprotein(a). We don't know at this point if the visipa lowers it. I don't believe I saw that they actually reported the lipoprotein(a) levels. So that sub-analysis might be coming, but at this point, we don't know if that's the case. We are part of some trials, though, that are specifically looking at targeting lipoprotein(a) as a marker of reducing risk, and we don't know what they'll show yet, but it'll be interesting to see.
Absolutely. So John asks if it's worth measuring your omega-3 and 6 levels, and he specifies that there are companies out there that are doing that.
Yeah, there's a lot of things we can do. The question is, should we do it? And so routinely, we don't measure them, and we don't really have a target goal. We know that in general, higher seems to be a little bit better in terms of the level, but at the same time, by the studies, higher wasn't better. It was the people that took it in once to twice a week, and so their EPA levels aren't very high necessarily, and yet they still have benefit. And so I would kind of focus on the overall heart outcomes. We've had this in preventive cardiology before, where we follow levels of, folic acid or B vitamins in the blood or homocysteine, all these other things, and they haven't panned out in terms of improving outcomes the way we thought. And so, at the end of the day, it's about not having a heart attack, not having a stroke, not getting a stent or bypass, and it's about feeling good. And so those are really the outcomes we should focus on.
Absolutely. So a good question, I think, to end off on here and to wrap things up here. So the question is, and it's kind of a two-parter, but what are you most excited about regarding the use of fish oil or the research surrounding fish oil? And if you have any final comments for the audience.
I guess I like this research because it gets back to how important nutrition is. We know that what we eat is one of the primary determinants of our cardiovascular health. And so the more information, the more knowledge we get about the importance of nutrition, the easier it is to talk about our patients. And, compared to medications, which typically are funded by industry, which is great, we don't have a lot of funding for cardiovascular nutrition research. And so the more funding we can get for that, the better we're going to understand this and the better we can communicate with our patients.
Absolutely. Well, thank you very much, Dr. Miedema, for your time and expertise today.
Yeah,
we really appreciate it. And to our attendees, thank you very much for joining us. We will be sending out a post-event survey and a follow-up email, as well as the recording to this talk today, so you can review it and send it to your friends and family as well. But again, Dr. Miedema, thank you very much, and everyone have a great day.
Thanks, everyone.
Yep.